East Coast, and thank you for joining WomenHeart, the National Coalition for Women with Heart Disease, for our webinar, Welcome to WomenHeart Pre-Symposium Webinar. I'm Eva Maciejewski, the Manager of Communications and Marketing at WomenHeart, and today you will hear from Lisa Clough, our Vice President of Public and Patient Programs, who will give this presentation. After her presentation, she will take questions, and you will have the opportunity to ask all the questions that I'm sure you have about the Spring 2014 Science and Leadership Symposium in Washington, D.C. I will give you instructions to submit your questions for the Q&A after Lisa Clough's presentation. So without further ado, let me turn it over to her. Lisa?
Hello, ladies, and thank you for joining us today. It's really a pleasure to have you all on the line, and we are so looking forward to seeing you here in Washington in just a couple of weeks. But every time we do a Science and Leadership Symposium, we like to take this opportunity to just give you a brief overview about WomenHeart, to talk a little bit about what's coming up at the symposium, and then, of course, as Eva mentioned, to answer your questions. So let's get started. So first, since I know many of you coming to the Science and Leadership Symposium this year are new to the organization, I wanted to just give you a brief overview about WomenHeart. We are the first and still the only national organization solely devoted to women's heart health, and we were established in 1999 by 3 heart attack survivors who experienced quite honestly, and unfortunately, much of the same thing that I've heard from many of you in our interviews and conversation. The discrepancies in care, the misdiagnosis, feelings of fear and isolation, and very little information and support. And so WomenHeart has really strived for 15 years to create a leadership role in this space of the women's heart movement. And we've done a real good job, I think. We're now a 501c3, and in 2014, we have an annual budget of $4 million. So who are we? Well, as I mentioned, we're the nation's only patient-centered advocacy organization, and we serve the 42 million women living with or at risk for heart disease. And the breakdown on this is typically about 8 million women living with heart disease and about another 34 million at risk, which is typically described as living with 1 or 2 of the major risk factors. What does WomenHeart do? Well, I think on our calls, we spoke to many of you about this just as an overview, but let's reiterate it here for everyone. WomenHeart has a 3-pronged mission. We do education, of course, to raise awareness about heart disease as the leading cause of death in women. We also do patient education in the form of both primary and secondary prevention. We also advocate. We have a very strong federal advocacy initiative, and we hope to be able to begin a state and local advocacy initiative in the future. And then what really makes us unique in this space is that we are the only organization providing support to living with heart disease. And we'll talk more about that, but this is really key to you all, because this is what you're coming to this conference to do, to learn how to lead WomenHeart support networks. This is really the link in communities to helping women who maybe were one time in the same position you were, and to really bring them along and help it really empower them to take charge of their heart health and live longer, heart healthier lives. Why we're different. WomenHeart is different because we're the real women. We are boots on the ground in the fight against heart disease. Since 2002, we have trained over 650 women heart disease survivors to be what we call WomenHeart champions, and you all will join the ranks of these women. These are all women who are living with heart disease, like yourselves, who are really making a selfless dedication and commitment to helping other women in your communities. And this is what makes us different, and this is what makes us recognized. And this is how we make such a difference. We mentioned that we're the first and still the only national organization devoted to women's heart health. You see there, we do a lot of public speaking and health fairs, and then the other picture there on the side is at an event that took place with one of our WomenHeart champions in her community for Heart Month. The next slide is a really interesting piece that Women's Day magazine published in 2013. This is Women's Day magazine's 10th anniversary last year of supporting women's heart health and making women's cardiovascular health their priority cause-related issue. And in the publication last year, in the February issue, I believe it was the February or March issue, they published this timeline of the women's heart health movement. And you'll see right up there in the left corner the picture of Jane Chestnut, who in the early 2000s was the editor-in-chief of Women's Day, and who really attached herself to this cause of women and heart disease, really saw and recognized that it was the leading cause of death in women, and that something must be done about it, and that she had a platform for this incredible magazine to be able to do that. And so they've continued their commitment. Jane actually is no longer editor-in-chief of Women's Day, but she has been a member of the WomenHeart Board of Directors for several years. So the next page is meant to really help clarify some things that we learned over the years. There's a little confusion about, and maybe just never put out there in quite this form for folks to understand. But as we all know, there are a lot of good people doing good things in the women's heart space to help save lives. And what we wanted to do here is really lay it out for you all so you can see for yourselves where WomenHeart fits into all of this. So in 1999, when WomenHeart was founded, its founder and a physician went to the National Heart, Lung, and Blood Institute, which is part of NIH, and literally the stories I've heard are that they knocked on doors until somebody would listen and said, this is the leading cause of death in women. More women are dying from this than men. You need to do something about this. And NHLBI answered the call with a working group that looked at data, evaluated everything that was out there, and said, yes, we are going to put major funding towards this. And for now 12 years, the Heart Truth Red Dress campaign at NHLBI, which many of us are very familiar with and which we have a very close working relationship with, has been the national symbol of raising awareness of heart disease as a leading cause of death in women. The campaign does general public awareness. They do some research about women and heart disease, and they really act as the umbrella for this issue. The other founding partners of the campaign were the Office of Women's Health, which is over at the Department of Health and Human Services. Again, they do a lot of education and awareness. Another founding partner was the American Heart Association, and they established their Go Red campaign, and they raised money for research. And then, of course, WomenHeart, who was at the forefront of all of it. And our niche in this space is providing patient support and really touching the women living with heart disease to make a difference in their lives. So why do we do what we do? Well, we talked about this a little bit. So there are a lot of women living with or at risk for heart disease, and so we know there's a lot of ground to cover and a lot of women to reach. It is the leading cause of death in women, and to this day it kills, heart attacks alone kill more women than all cancers combined, not to mention other forms of heart disease. Heart disease is increasing in younger women, age 35 to 54, fastest growing segment of the population developing heart disease. We know that awareness remains low among many women and providers, even though there's been great strides in that area. It's still not where I think we all want it to be, and so we work in those areas as well with trying to educate and raise awareness among healthcare providers. We also look at disparities in care. Why are women less likely to receive treatment according to guidelines? And even sometimes, to be honest, most of the guidelines are done with most of the research being done on men. So sometimes maybe it's not even guidelines-based care. Maybe it's care that is specifically better for a woman or for that particular woman. So we look at those issues. And then, of course, I think we're all aware that women are underrepresented in clinical trials, and this is a major focus of WomenHeart's moving forward, is to find ways to get more women into clinical trials, because until we have answers to how heart disease is manifests, is diagnosed, and is treated in women, specifically in large numbers, we will be challenged to have the answers to truly help women prevent, be better diagnosed, and be more accurately treated for long-term better outcomes. So here's WomenHeart today. We're a thriving organization with a membership. You know, there should be other membership numbers on here, but this is just for our database and our electronic newsletter. We also have very active Facebook pages and Twitter through social media. We have our 656 WomenHeart champions around the country who are trained community educators and spokespersons. And they were trained at the WomenHeart Science and Leadership Symposium, just like you all will be. And for those of you who don't know, until this year, the symposium has always been held at Mayo Clinic in the fall. They've been our partner in this for many years. But because our National Hospital Alliance program is growing so quickly, we decided to kind of plug in, if you will, an additional training, which is the one you all will be attending in just a couple of weeks in May this year. So we're excited to be growing our support services even faster. We have 121 local support networks meeting monthly in 39 states, and we hope to have a WomenHeart support network in every state by the end of the year. We have a very active and involved dynamic website with more than 50,000 unique visitors monthly. As I mentioned, there are Facebook and Twitter addresses for you all to become involved with. We also have a very active online patient community through Inspire, which weekly grows by almost 200 women weekly. So that tells you something about the need. So if any of you are not on Inspire yet, go to Inspire, register with WomenHeart, and you can start taking place in the discussions on that discussion board. And then, of course, as I mentioned before, we are a founding partner of NHLB's Heart Truth Red Dress campaign. So this next slide, number 11, is our Scientific Advisory Council. For those of you who came into this not really being real aware of who WomenHeart is, this should really help any questions you may have. This is a list of the country's leading authorities on women and cardiovascular disease, and they are the WomenHeart Scientific Advisory Council. And this is not just a list of high-powered physicians and others in the field, but rather this is also a group of folks who are very actively involved in our organization on a daily basis. They do everything from approving the content of medical and scientific information we put out to helping us with testimony. Our CEO recently testified before an FDA panel. They are involved with us on a number of levels in a number of ways, and this is on a daily basis. Another thing you need to know about WomenHeart in this space is that we have a lot of partners. We have, you probably recognize many of the logos and the organizations there, and we have active partnerships with all of them on many fronts. Mayo Clinic, as you know, is a partner in our Science and Leadership Symposium. The Make the Call 911 campaign was with the Office on Women's Health to educate women about the signs and symptoms of heart attack and urge them to call 911. The Society for Women's Health Research, we did the 10Q report with, which you'll learn more about. Million Hearts campaign is with the Centers for Disease Control, and on and on. So as you can see, we have great partners to help us continue our good work and also to support the work of their organizations that meld with ours. So we have a number of key programs, which you all are about to start at the launching pad with the Science and Leadership Symposium and become part of our National WomenHeart Champion Network. We have an educational tool called the Red Bag of Courage, which you'll learn more about at the symposium, which we distribute 100,000 of a year, and we now produce in both English and Spanish. We also have a heart-to-heart monthly e-newsletter that goes to about 25,000 folks in our database. Let's see, patient support. This is the key area you all will be involved with for the organization. We have a number of ways that our trained women do provide support. As you all know, what you all will be doing is going back to your communities and starting an in-person peer-to-peer support network for other women living with heart disease. But eventually, we hope to help you learn how to be involved in Sister Match, how to develop a Heart Scarves program, and we hope that you too will become involved in the online support community. And you'll be learning more about all of those opportunities when you come in May. And then, of course, our advocacy initiative is making tremendous strides with the passing of one piece of legislation last year that is now requiring the FDA to report clinical trial data by sex. So that will help us better understand how many women are in trials and how the trials affected them. So we will start to get a better understanding with those studies that pertain to women and heart disease, how exactly these things are affecting women and how we can move forward from there to both educate women and to make a difference in their quality of life. I'll just mention one other thing on that slide that I saw right as we were flipping it. We can go back just 1 second. The annual Winger Awards Dinner under Advocacy Program. This is something you all will be attending when you come to Washington. We're so thrilled that you all are going to be here. This is our annual gala to really recognize individuals and organizations who are doing extraordinary things to advance women's heart health. And this year, our honorees are Dr. Thomas Frieden, who is the director of the Centers for Disease Control, Dr. Mary Noreen Walsh, who is on our Scientific Advisory Council, who has long been a very loud and proud voice in the advocacy arena and clinical trial area for women in heart disease, and has really helped make great strides there. And then Burlington, who you all may be aware, we do the big partnership every year to raise money for the organization, to continue our good work, continue the expansion of programs like what you're involved in, which is helping enable you to be part of this, and to reach underserved women in the communities where those stores are located. So this is a fabulous evening. We can talk more about it during the Q&A if you all have questions. It's a very high-level evening of all of our favorite folks in our community. It's at the Ronald Reagan Building in Washington, and we're all looking forward to having you with us. So let's talk a little bit about the Science and Leadership Symposium that you all be attending. This is our signature program, and it was started in 2002. Heart disease survivors such as yourselves travel to Mayo Clinic for a 4-day intensive program. This year, of course, it's Washington, D.C. Although we are incorporating many of the same programs and educational information that we always do when we go up to Mayo, there will be some new and exciting programs as well. You'll learn about from leading cardiologists the science of heart disease and how to become spokespersons and support network coordinators. And as you can see, we're currently in 49 states, and our ranks are about 25% diversity. Our support networks, which you all will also be joining the ranks of by running these support networks, currently 121 in 39 states. Our women meet monthly to provide heart health education with an emphasis on secondary prevention. So for those of you who maybe don't know that term, secondary prevention are preventive strategies for the women who have already had a heart diagnosis or a heart event. So these are all programs and information that we will provide you to help them and yourselves live a heart-healthy life and to keep your heart healthy. We're going to be able to work together to identify and include new patients into these groups, and we'll talk strategy on that at the conference. And most all Women Heart Support Networks are based out of hospitals, cardiac clinics, and cardiac rehab. This is coming through our National Hospital Alliance program, which we'll talk about in just a minute. Some of our other support networks who have been around long before our National Hospital Alliance program came to be about 3 years ago. The networks are being operated at a variety of locations, some in faith-based communities, some in other community-based settings. But those of you coming with National Hospital Alliance members will start off with a hospital-based program. And then potentially that member will move on from there, bringing other women into the program that will do the program in other ways. And then another way that we're also starting support networks is by doing them, by doing virtual support networks. We have one running out of Kansas City right now, and we're hoping to have one on SCAD to be starting up later this year after this symposium. So we're looking forward to starting the Women Heart Cafe virtual support networks so that women from all over the country can hear our message and get the support that they need, and not necessarily be community-based, because many women are still in communities where a Women Heart peer-to-peer support network does not exist. So here's a little bit about the National Hospital Alliance. But first let me just explain who's attending the symposium this year and where this fits in. So about 3 years ago, WomenHeart developed the National Hospital Alliance program as a strategy to build our community-based coalitions and to give our Women Heart champions and support network coordinators a real foundation and launching pad for their efforts. And for most communities, and for us, there was no better partnership than to try to do that with a hospital. So as the years go on, the National Hospital Alliance will become the primary feeder for training new women to lead support networks. And, you know, someday our hope is that every hospital in the country has a Women Heart support network to support its Women Heart patients. But in the meantime, in order to keep our support programs growing. We have also offered this training to existing WomenHeart champions who would now like to become support network coordinators. We have also offered this training to women who have been helping a WomenHeart support network coordinator who would like to be officially trained to be her co-coordinator. And so that's where we're at with the program. So it's a little bit of a mix of all of you that are coming, but we're excited to have everyone, and you will all play the same role in the organization and continue to move these services forward. So back to slide number 19. What has happened with National Hospital Alliance members is that the hospital has reached out to the community, or maybe specifically identified you to attend this program. You applied. We did your interviews just like we did with everyone else who's coming. But when you return, you'll go to your hospital to develop and implement your network. For those of you who are WomenHeart champions without a hospital base yet, we will work with you to hopefully help establish that. And for those of you who are co-coordinators, you will just continue your co-coordination work with your current support network leader. As trained volunteers, you will all help lead monthly support meetings at the hospital, and you'll serve as a spokesperson in the capacity of WomenHeart and a WomenHeart Support Network coordinator. You're not a hospital spokesperson. And just so you all know, the only thing we ask the hospital to do, and we'll talk more about this at the symposium, and after you get back from symposium, we'll do calls with you all in your hospitals. The only thing we ask your hospital to do is to provide you the space for your meeting, market the meetings through the existing marketing channels that the hospital has, and to provide clinical support as needed for your sessions. So if you want a diabetes educator 1 month for your meeting, you ask them for somebody to contact, and you contact and arrange that. So they should be able to support you in that way. And of course, we ask the hospital to pay their annual fee to keep the program going and to bring more women into the program so they can have more support networks throughout the community. Okay, WomenHeart provides infrastructure. This is something else just to be aware of. Those of you who are not yet connected to a hospital but may want to be in the future, and those who currently are connected. Through National Hospital Alliance membership, WomenHeart provides the training of our patient volunteers. We will be providing you with ongoing materials, publications, and webinars to keep up your education to be the best support network coordinator you can be. We provide ongoing technical assistance and networking with other support network leaders. You all have district leaders, and you have other women within your district running support networks, and we will connect you with them. We have annual in-person educational update and skill building conference. Actually, that's what you're attending in May. You all will start on Friday and go through Saturday afternoon, and then at that point, all of the support network coordinators from around the country will be coming in, and we will roll you all into one big conference. So it's going to be very exciting for you to meet all these other ladies and to learn from them, because one of the things we really like to do is have them present best practices. Many of them are very seasoned, very good at what they do, have been very successful, and they come to share that with all of you. And then, of course, to be able to offer other programs that hospital patients can benefit from, such as Heart Scarves and Sister Match. So this is an interesting slide, number 18 here. Patients attending support networks, we learned several years ago through a survey that we did that they really do benefit from the services we offer. We really wanted to document this and see where these ladies were at, and we were so, just pleasantly, I don't want to say surprised, because we thought what we were doing was a good thing, but we were just so pleased to have this validated, that what we are doing is enhancing the quality of life for women living with heart disease. They're adhering to their medications better because they feel more educated and empowered. It's improved their ability to communicate with family and healthcare providers and coworkers and friends. Again, they feel empowered, they feel more educated, they feel more confident living with this condition. So they're able to communicate better and take better care of themselves, and that's exactly what we want these networks to do for them. So here's just a little bit on advocacy issues. Susan Campbell, our Director of Public Policy, could not be with us today. So she put a little bit of information down here just for you all to know about what is going on with our advocacy program, especially since you all have the opportunity I think you've already gotten the correspondence about scheduling your meetings for Capitol Hill on Tuesday, May 20th, that morning. So these are some of the things that Susan will be doing a session on at the conference and also doing an update the morning before you go to Capitol Hill. But these are all in strategic priority areas for WomenHeart, and they're all at various levels of progress and accomplishment, and Susan will be discussing these a little bit more when we see her in a couple of weeks. So just a little bit about clinical trials. This information here is really kind of the status of where things are right now and the type of thing on what we are responding to and try to affect change in. We just finished a broad strategic plan. By broad, I mean it encompasses a lot. However, it's very specific what we need to be focusing on. And this is one of the priority areas that Susan will be doing a lot of work in. And I think this is one of the things she will be talking to you all at during her session in the conference. So this was a highlight for us on the advocacy front a couple of years ago. Us, along with a couple of other organizations, partnered to get the White House to do a community leaders briefing on heart health. And many of our WomenHeart champions came in from around the country. They were recognized by the President's office from the podium as being there. And it was an exciting day for all of our women to have the opportunity to ask questions, to speak publicly about what it was like to be a woman living with heart disease, and to really provide critical input to the administration on how this disease affects not only the woman herself, but family and community. So the next slide is our current board of directors. It's very active, engaged, and really just a terrific board. Our board is typically made up of half WomenHeart champions and half others who are qualified and bring some skill set that we need to the board. And we also, the board chair is always a WomenHeart champion. So so this is our group this time around. The terms are for 3 years. They can be renewed for another 3 years. And if this is something that you aspire to at some point, stay involved with the organization, look for opportunities for other leadership positions, and at some point, you know, this may be something that you would want to pursue as well. So pharma, medical, and device supporters, this got a little out of order, I apologize. These are folks that help to fund our organization, and just for purpose of explanation, important to note that these are all sponsorships and grants that we get from these organizations. So the way we work with them is, for instance, let me pick one out here. The Santa Fe Aventis several years ago was in the diabetes space, and they gave us a grant for developing diabetes education materials. And we produce those independently. They do give us the grant, but they have no involvement, and these are unbiased educational materials, completely unbiased, fair balance materials. We work with our Scientific Advisory Council to be sure that the scientific and medical information is correct, and that's how we work with these partners, and we have many of them. They're very committed to not only the space of women's heart health, but WomenHeart in particular. These are some of our corporate supporters. These are folks that we usually do high visibility public relations campaigns with around an issue around heart disease in women. So we talked about Burlington a while ago, and so our campaign with them is all about reaching women who are at high risk for heart disease. With Bear Healthcare, actually this coming weekend, next weekend, we will be launching our annual campaign about the role of aspirin therapy in preventing heart attack. We do a, let's see, gosh, we've done campaigns with all these folks on various topics over the years. Cheerios campaign was about fiber and lowering cholesterol. Nature Made was about the role of supplements, and so on. So these are fabulous campaigns that that really bring home very targeted messages to consumers, and typically a lot of media support. So these last couple of slides here are about the strategic priorities of the organization, and I wanted to share this top line with you of our strategic priority, our strategic priorities. These are the most important things that we will be focusing on over the next 3 years, And while they each have a whole bunch of activities underneath them that we are busy working on here in the office, these are the main areas of focus for the organization. So of course the first thing is we need to raise the funds necessary for our organization to exist and thrive and grow. And along with that, we want to be able to increase our organizational visibility. So those are kind of first and foremost. But then when we get into programmatic areas, we're looking at these other things, such as ensuring the access to information education necessary for all women to take charge of their heart health. We want to increase the number of patients receiving peer-to-peer support. This is where you all come in. We want to ensure that all women receive expert, appropriate, affordable, sex-specific cardiovascular care. You know, there's a whole lot of things under here that will lead to helping that happens. We want to promote the advancement of the science and knowledge base and policy awareness for provisions of optimal cardiovascular care for women. This is something that is critical to better defining what medical professionals need to know about how to prevent, diagnose, and treat heart disease in women. We want to promote increased awareness, access, and willingness for women to participate in research, as we talked about before. And we want to, of course, get more women referred to and participating in attending and completing cardiac rehab programs, because we know from the data that attending and completing cardiac rehab is critical to good patient outcomes in women living with heart disease. So that's a lot. So what about that trip to Washington? Well, let's talk a little bit about that for a minute. I'm sure y'all have some questions, so I won't belabor this one. We'll just kind of get through this. So you know, it's middle of May in Washington, so it's warm. But I was over at the hotel the other day for a site visit with some of the other staff, and it's cool in there. They keep it cool. So wear your comfortable clothes, bring something, and we go for a walk every morning for anyone who wants to go for a walk. We go walking every morning very early. There's trail right outside the hotel. So bring clothes for walking, clothes for stretching and other activities. During the day, it's kind of business casual, very comfortable for our sessions that last all day. We need something dressy for Friday night, which is your opening dinner. Saturday night is another dinner, and you know, this is a nice dinner and everything. We're all together, and there'll be some presentations, but we basically, I think we have a break and then we go into dinner. It's not a fancy dinner or anything like that. You can just feel free to be very comfortable in your conference clothes that day for Saturday night. Sunday is a dressy dinner because that's your graduation, and then we are also honoring 10 of our support network coordinators who have been in this position for 10 years or more. So it's a big celebration night for us internally with all of you all. And then, of course, Monday night is the Winger Awards dinner. And so something a little dressy for that is good as well. And red is always good. In fact, I think one of the things the staff has gotten used to seeing and really enjoy is all of the fabulous red clothes you all have. We've never seen so many wonderful red outfits, jackets, sweaters, skirts, pants, shoes, earrings, you name it. So so wear your red, wear it proud, and we'll look forward to seeing you in that. There are some recorded webinars that you all got a notice about from Miranda. Your login should be working. If they're not working, please email Miranda after this webinar. Let her know. On Monday when she gets in, she will be glad to follow up with you, because you do need to look at these webinars prior to coming to the symposium. They are required, and they will lay a great foundation for you for everything that comes after. Bring your laptops, iPad, or tablet. Not only do we have website training programs, but we're going to be doing a lot with social media from the conference. We have a couple of campaigns launching in May, so we're going to have a lot of fun tweeting and Facebooking every day those messages out at various times. And but there's also going to be other reasons that you may need it from time to time, so please bring those so that you have your own to work from. And if you can't, try to bring the one that you work on regularly so that you can familiarize yourself with how to do that. We ask no perfume at the symposium, please. There are sensitivities, and we would appreciate if we keep that down. Make sure you have some extra room in your suitcase, half empty, or bring an extra bag. because you're going to be getting a lot of materials. There are things that we will ship to you when we get back here that will stay here at the office, but there are things you are going to be getting at the conference that you will need to take back with you, so make sure you have some extra room. On Sunday morning, we'll be doing professional photos around the breakfast time. There will be 3 set times that you'll see on your agenda that we'll get out to you before the meeting, where you all will have a group class photo. There will be some other group photos, and then there will be about 45 minutes for you all to have your individual photos taken, which we really like for you to do so that we have that on file with all of the rest of your file. And Eva, who you spoke to a minute ago, who's our communications manager, will be managing the whole photo shoot session. So, bring a little makeup to touch that morning, and you guys can help each other with your hair, and everybody will look great. And the photo session is always a lot of fun. And then, and then again, the bottom one's really about the half-empty suitcase. And, just the conference materials you're going to be collecting while you're here. Okay.
Well, thank you so much, Lisa, for this very comprehensive presentation. This is Eva again. Well, I am sure that all of you ladies have a lot of questions for Lisa, and so I'm going to begin the Q&A portion of this webinar. And so let me give you the instructions for the Q&A. As you will see on your GoToWebinar control panel, there is a question mark icon. If you click on that icon and type in your question and then click Submit, your question will appear on my control panel, and I will be able to read the questions in the order in which they appear. Nobody else will see your questions except for me, and also Marissa Riggin, who is WomenHeart's Associate for Community Education, whom you will all meet in a couple weeks, and who is here to help me with the Q&A today. So please start typing in your questions, and we will start reading them, and Lisa will start answering.
Hello, ladies. So our first question, well, it's actually a comment. It's from Catherine Leon, and it's loved hearing the words, SCAD Virtual Support Network. Woohoo, thanks, Lisa. So thank you, Catherine.
Okay, ladies, we are waiting for your questions. Again, if you just click on the question mark icon and type in your question and hit Submit, Marissa will read your questions.
All right, this is from Brenda. Her question is, I did not receive any information about Capitol Hill. Was I supposed to?
Yes, Brenda, actually you were. I'll follow up with Miranda and Susan on that, and we will make sure that you get that information. Ladies, this is Lisa. I'm trying to think of other things that I can tell you all about the weekend. So sessions start on Friday afternoon. I believe it's at 1 o'clock or 1:30. You'll be meeting with your district leaders, and there will be like a nice meet and greet with them. And then following that, we'll be giving you an overview on WomenHeart support networks, and then we'll go into our first 2 sessions of the day, which we're very excited about. One is being presented by a nurse from NIH who's going to talk about the status of some clinical trials going on with NIH that include women that are about heart disease, women specific. And then the other one is actually going to be about the role of cardiac rehab in recovery and why it's important for women, and about exercise after your heart event or heart diagnosis. So we feel like it's a really exciting way to kick off the conference.
We have another question from Catherine. Is there a list of the webinars on the website? I'm not sure if I received that email.
Okay, again, there are. It's in an area that you all will, I think Miranda gave you all the link. Again, I'll follow up with her on that. And you know what, if anyone else did not get some of this information for whatever reason, just email Miranda on Monday if you don't have what you need. So, so there's the Capitol Hill info, and there's the info for the webinars. And she'll be able to get that right out to you.
All right, do we have any more questions?
You know, I'll just add while you all are thinking that, you know, at any point over the next couple of weeks as you're preparing to come, if you have any questions about, you know, whether it's about, you know, what to bring, what to wear, what we're going to be doing, you know, anything about, like these questions about the Hill info, the webinars, whatever it is, you're welcome to email Miranda or myself, and we'll be glad to get back to you right away with everything that you need.
All right. Well, I'm looking forward to meeting you all in May, and it looks like we don't have any more questions, so I'm going to hand this back over to Eva.
Great. Thank you, Marissa. Well, thank you so much, ladies, for taking part in our webinar today. We hope that it was informative, and speaking for myself and for all of us, we're so excited to meet you in less than 3 weeks. And Lisa, did you have any parting words that you wanted to share?
I wanted to thank you all for your commitment to this, and just continue to take good care of yourselves, and have a wonderful couple of weeks leading up to this. We're so looking forward to meeting you and starting our work together, and the women in your communities are very lucky to have you on board.
Wonderful. This concludes our webinar. Thank you, Lisa. Thank you, ladies. Goodbye.